Our enemies say healthcare is unsustainable and that healthcare is so expensive our countries can no longer afford to provide it as a public service. The free market lobby persist in saying we must go over to a private system as if that would miraculously make healthcare more affordable. But it wouldn't, would it? It wouldn't reduce the number of old people. It wouldn't reduce the extra costs of new and better treatment. The only way private medicine could reduce the number of old people would be if private clinics let people die sooner. That would apparently is their answer. And the only way they could reduce the cost of new and better treatment would be by restricting the use of those new and better treatments to the rich and denying them to the rest of us. And in practice, as you all know, and everybody who thinks about it for a minute knows, private medicine pushes costs up, it doesn't push costs down. And I usually quote two professors from Harvard Medical School, Professors Woolhandler and Himmelstein, who put it this way: remedies from commerce consistently yield inferior care at inflated prices. In the 20 years up to 1997, the NHS had been severely underfunded. Many hospitals needed to be replaced, equipment modernised, many more staff were needed, and the whole workforce needed to be better paid. Following the election of the Labour government in 1997, promising to put those things right, funding was increased only marginally in the first 2 years. But even in those first lean years, we launched the biggest hospital building programme in UK history and started modernising every accident and emergency department. New and better equipment was provided for existing hospitals, and many more staff were recruited and wages were increased, and new arrangements were put in place to raise the standard of treatment. Waiting lists and waiting times started to come down, but before most of these changes had the opportunity to prove their full worth, the Prime Minister, Tony Blair, off his own bat, decided to bring in the private sector. He was encouraged by think tanks. I think you've got them. I think most of them, there's more tank than think to most of them. And various other vested interests managed to convince him that this was a good idea, despite the fact there wasn't any evidence at all that the NHS was incapable of meeting the health needs of the British people, nor that alternative providers would be cost effective and do a better job. So his act of marketisation was an act of faith, and seldom has such faith been so misplaced or so badly rewarded. We were told the private sector would augment NHS provision, reduce costs, and bring about clinical innovations. After a year or two, we were told it had happened. But this was simply not true. Far from reducing costs, the private providers were charging the taxpayer, on average, 11% more per operation, 11% more, than NHS hospitals got for doing the same operation. In other words, the private sector was providing 9 operations for the price of 10. And they got this 11% extra, despite the fact that the private sector, with its very limited list of elective work, was creaming off the easy, straightforward, less risky operations on otherwise mostly healthy patients. Waiting lists were halved under the Labour government, and the promoters of privatisation have had the barefaced cheek to claim that it was private sector hospitals that reduced NHS waiting lists. This again is a lie. In the years before the involvement of the private sector under Labour, the average annual reduction in waiting lists was 67,000, including a reduction of 224,000 in 1998-99, I say that because I was Health Secretary at the time. The biggest ever reduction in the history of the health service. And after the private sector got involved, the average annual waiting list reduction fell from 67,000 a year to 40,000 a year. Under the Labour government, in the 13 years we were in, the number of NHS inpatient operations rose from 6,400,000 to 9,200,000, a rise of 2,790,000 people, or 43%. And during that period, private sector treatment of NHS patients as a proportion of that total rose from the staggering figure of 0.18% to the giddy heights of 1.09% in the most recent year. But the lying bastards from the private sector are still claiming it was they who reduced the waiting list. In 1998, when I was Health Secretary, I set a target of a maximum wait of 3 months for a cataract operation. Tony Blair subsequently claimed this target had been met 3 years early because of the work done by the private sector. I don't like calling individuals liars, so I say he must have been very badly briefed. The facts are that in 1998, the NHS was doing 160,000 cataract operations a year. By the time he made his claim about the wonders of the private sector, the NHS had raised that total to over 300,000 cataract operations a year, while the private sector had managed to do just 20,000 cataract operations. Not 20,000 a year, but a cumulative grand total of 20,000, as against the 300,000 a year that the National Health Service hospitals were doing. So I hope governments here in British Columbia and around Canada will think twice before going ahead with funding private clinics. And if the promoters of privatization start making claims about how well it's worked in Britain, you should make sure that the people here get the plain facts and not the fancy fiction. There is another huge problem, I think, which sometimes gets ignored with the new competitive market, and that is it inevitably adds to the overall cost of the service. And let me tell you what's happened in Britain. Before the Tory government in the 1990s introduced an internal market in the National Health Service, the administrative costs of the NHS amounted to just 4% of total costs. 4 pence in the pound, 4 cents in the dollar. That was lower than any other healthcare system anywhere in the world, far lower than any private sector healthcare provider, and for that matter, far lower than any supermarket chain. The lowest estimate of the transaction costs with the new market system is 12% of total spending. And some believe it's even higher, but I don't want to exaggerate. So the British taxpayer is having to cough up that extra 8% of total spending on administrative costs compared with the old system. And I've worked it out in Canadian dollars for you. That is equivalent to an extra $13 billion a year going on the paperwork of the competitive system. 13 billion on the unavoidable extra bureaucratic costs of a competitive system. Most Canadians are proud of your public healthcare system, and rightly so. It's paid for by everybody, used by everybody, and it pools the cost of treatment and care. And that way, nobody's denied treatment or deterred from seeking treatment because they can't afford it. And that's very unlike the market-based system in the United States. In this country, everybody's covered. Now, although the Canadian healthcare system is province-based, The federal government is there to set standards which every Canadian citizen can expect, whichever province they live in or work in or visit. It's not my job to tell Canadians what to do, but it seems to me that while the coverage still remains patchy and variable than was originally intended, it seems to me the federal government's role is crucial and must continue. With the support of the public, people with courage and foresight and idealism decided to make the best health services available to all. And they did that in the teeth of fierce opposition from the privileged and the powerful. And they and you can be proud of what they achieved. Now, when our countries are so much better off than they were then, it's our job to resist the latest attacks from the privileged and the powerful. And I think the best answer when they tell their lies is just to spell out the truth. And the truth is, your healthcare system isn't just fairer than, say, the setup in the United States. Compared with the United States, it costs about half as much per head of population. It's more efficient, less wasteful, and more cost-effective. Now, like every other healthcare system in the world, it has its problems, but it isn't in crisis. It's only the enemies of your healthcare system who say it's in crisis, and they're the people who are threatening it. And all over the developed world, reactionary politicians, academics and news media keep wringing their hands about the rising cost of healthcare. And there are three major faults with their view of the world: hypocrisy, vandalism, and ignorance. First, hypocrisy. They want first-class healthcare for themselves, but say we can't afford it for everybody else. Second, vandalism. They want to foul up the public health systems, which are already the cheapest and most cost-effective. Third, ignorance. They ignore the fact that, as Professor Evans made clear yesterday, the biggest increases in health costs come from the very goods and services already being supplied by the private sector, the buildings, the equipment, and of course the pharmaceuticals. When I was taking part in a CUPE campaign in Ontario in, I think, 2006, one of them really let the cat out of the bag on television. In a TV discussion with Natalie Mehra and me, this free marketeer proclaimed that with a market system, patients could choose between a Holt Renfrew quality operation and a Walmart quality operation. And with respect to Walmart, that won't do, will it? I mean, when it comes to healthcare, we don't want the cheapest, we want the best, and we want the best for everybody.